how to make a cardiac clinic referral. Between the three, we have the heart function clinic, the lipid clinic, the cardiac rehab and prevention aspect of the clinic as well. We'll give you an overview. We'll discuss our team. We'll talk about the patient journey, the referral processes, and some contact information and the locations for each of these. And so just under our heart health programs here at JP, we have chronic disease management as our focus. And under the umbrella, we have the heart function clinic, which is secondary prevention and end of life. Then we move on to our lipid clinic, which is a specialty that focuses on primary and prevention. And then the biggest bulk of our patients come in towards our cardiac rehab and prevention, which we have secondary and primary as well as prevention. And the big piece is the education and exercise portion of this. So Jerry's going to talk to you in detail about how to get the referrals going and give you some more of the specifics. I'll hand it over to you, Jerry.
Great, thanks, Mariah. So we'll jump right in here. All of you kind of want to know, how do you make the cardiac clinic referral? So you'll hear the term cardiac clinic or heart health clinics. As Mariah said, there's 3 clinics at Jim Pattison. There are 3 separate referral forms depending on the clinic you're referring. So one for the heart function clinic, one for the lipid clinic, and another for the cardiac rehab program. As most of you know, you can find all of those forms on your pathways. They also can be found on the Fraser Health medical staff website, and the web is there. I have been asked to mention that that is under construction right now, so I'm not sure what it's going to look like, but it is going to be revamped and look a bit new sort of mid-June. So if you are going to be finding the forms on the Fraser Health site, you just click clinical, JPOCS clinical in services forms, and then choose the appropriate referral form. Okay, one thing I would like to mention that we do have within our heart function clinic a subset of a type of heart failure called amyloidosis. There is a separate referral form for amyloidosis, which I believe is on pathways as well. But I just wanted to point out that you can also use the heart function clinic referral form and just indicate amyloidosis consultation. Okay. Okay, so just I'll start with the heart function clinic. So it is a specialty clinic. It is for clients that are diagnosed with heart failure. Just a brief overview, heart failure is a chronic condition that's caused by the heart not functioning as it should or by a problem with its structure. So generally the heart's either too weak or stiff, and so the heart just doesn't function well. And very common symptoms include shortness of breath, fatigue, lack of energy, and swelling in the legs and the abdomen. So you might ask yourself, what would be the reasons that I would refer to a heart function clinic? Well, you might suspect that your client has a diagnosis of heart failure, or perhaps they've recently been diagnosed with heart failure. Or your client has worsening symptoms of heart failure despite your best attempts on medical management. Also, your client might have had frequent use of the emergency room or admissions to the hospital for heart failure. Or you feel that they might benefit from a cardiology consult or self-management education. Additional reasons that you might refer is you would like advice on heart failure devices, or your client is not yet connected to a community cardiologist and requires an immediate consultation. I just wanted to be clear here, we don't accept general cardiology consults. Please do that separately, but if there is an immediate need, we will fit those clients in. Okay. There is specific criteria for the heart function clinic. As I mentioned, either established heart failure and or signs and symptoms of heart failure. We have 2 subsets of heart failure. We use a percentage called ejection fraction. So Clinically less than 35%, we will see those clients. If it's greater than 45% with signs and symptoms, we also want that backed up with a lab test called a BNP or NT-proBNP. Okay. So wait times are pretty quick. We will see your clients within 2 to 6 weeks. This is all based on Canadian Cardiovascular Society guidelines. We do have benchmarks that we are required to meet. So for urgent referrals, we will see within 2 weeks. For semi-urgent, we'll see within 2 to 4 weeks, and routine within 6 weeks. Please note that if it is an emergent referral, you should go through the on-call cardiologist. We do not have the capacity to see clients sooner than 2 weeks. The referrals will be reviewed by our medical team, and based on that referral, we will determine the urgency and how quickly they will be seen. Okay. Just of interest, we receive approximately 60 to 80 referrals per month. Most of our referrals come from the hospital as well as from the family physicians and from cardiologists. Our clients are with us for approximately 6 months, and I will talk later. Oh, sorry. Thank you, Mariah. I keep forgetting to hold on a second. There we go. Sorry. Apologize for that. So we'll talk a little bit about the patient's journey, which I said is approximately 6 months. Okay. All right. So as I said, the focus at the Heart Function Clinic is on heart failure management. Our services provided include assessment, planning, and diagnosis for clients with heart failure. They are consulted by a cardiologist and/or a nurse practitioner. We provide heart failure education on self-management and diet, and ongoing management of heart failure symptoms and medication management by the team. And the goals of the Heart Function Clinic are to reduce all-cause mortality, hopefully reduce heart failure hospitalizations and length of stay, improve better doses of medical therapy, improve better adherence to medication, and improve overall quality of life. Okay, so our team includes cardiologists. As I mentioned, we have approximately 9 or 10 cardiologists that rotate through our clinic. Our primary cardiologists are Dr. Tarun Sharma and Dr. Calvin Tong. We also have nurse practitioners. We have 3 currently that work with us. We have a unit clerk, dietitians, registered nurses, social workers, pharmacists, and we also have a nurse that works out of the Surrey Hospital as a liaison between clients that are in hospital and our clinic. Okay. So another part about the Heart Function Clinic is we do offer education. We teach individuals on what is heart failure and how to self-manage their condition at home, and also how to recognize the early warning signs and symptoms of decompensation. Some of the topics that we do teach include monitoring daily weights, recommendations for fluid and salt restrictions, medication adherence. We get them starting in some exercise activity. And again, as I said, recognizing those signs and symptoms and knowing who to notify. When they're with us, they can call us. And once they're discharged, to know to reach out to you if they have any concerns. Currently at Jim Pattison, we're offering education on a one-to-one basis. Historically, we have had group classes. Our hope is to have something like that in the future, but we're sort of looking at a regional program. So, we'll let you know about that once that comes about. But basically, our clients are provided right at that initial phone call with videos that they can watch, as well as links to heart failure websites. And a lot of those resources are also available on the Fraser Health intranet. And we're proud to be able to provide both English and Punjabi education. Nope, I went too far. Sorry, there we go. Okay, so I wanted to talk a little bit about the patient journey. About 4 years ago, we did a clinic remodel. Historically, our clients would be with us quite long-term, sometimes upwards several years. But we decided to come up with a patient journey of approximately 6 months. This has allowed us to be able to see a lot more clients and early intervention post-hospitalization. So with the heart function clinic patient journey, referrals come to us, as I said, mostly from the hospital. They are initially triaged by our nurse. She determines the urgency to be seen, and she books them on the phone right then and there for their first intake appointment. And at that point, as I said, we do start some education. Again, depending on urgency, they'll be seen within 2 to 4 weeks, and their first appointment will be with our cardiologist, a nurse, and our pharmacist. And in that appointment, they will have a comprehensive physical and symptoms assessment. They might determine the cause of the heart failure if required. They will provide recommendations for heart failure management and stabilization. We will usually initiate or adjust heart failure medications according to the Canadian Heart Failure Guidelines. We also might talk about advanced therapies such as the implantable devices. We do discuss advanced care planning early on in diagnosis important and assess the need for palliative referral as needed. And we do determine if they need any other allied health resources like social worker, dietitian, mental health. So as we move along the patient journey, every 2 months, our clients are brought into the clinic for an in-person comprehensive assessment, which is generally completed by our nurse practitioners. So it's very consistent follow-up. In between those 2 months, your clients will receive phone calls every 2 weeks approximately by either a nurse or a pharmacist. And within those telephone calls, we're just monitoring, how are their symptoms, how are they tolerating medication adjustments, and all to the goal to help them be stable and discharged within the 6 months. So once they are stabilized and on optimal medication therapy, they will be discharged back to their primary care providers. I just like to mention that we do recommend that a referral to a community cardiologist be made if they don't have one yet as early on as possible. Generally, our cardiologist will make that recommendation in their consult note to the family physician to make that referral. But however, if that doesn't happen, we do ensure that they do have some connection before they are discharged. Okay, so for the referral process, we receive the referrals via fax. As mentioned, they're reviewed by the medical team to determine the urgency of booking. The appointment is booked with the patient, and we then send a letter to the referring practitioner, usually the family physician, as well as the cardiologist, that they have been booked for the appointment date and time. The patient is also sent a confirmation email with the appointment information, as well as all those other resources that I mentioned earlier. We do recommend with referrals that if you do have an echocardiogram, to send that as well as lab work. It's not necessary, but it is helpful. We do also see re-referrals. They are considered on a case-by-case basis, but if your client's condition does change, please do re-refer. Usually their stay with us is much shorter, about 2 to 3 months. Okay, and here's some contact information and location. As you know, we're at the Jim Pattison Center. The Heart Function Clinic is located on the 3rd floor, desk 3B. Our phone number and our fax number you can refer to. The Heart Function Clinic is open Monday to Friday from 8 till 4 o'clock. Okay, so we'll move on to the lipid clinic. We are a specialty clinic for patients with high cholesterol who usually are not tolerating standard medication therapy or are high risk for heart disease, or they likely have a genetic predisposition. We provide consultation and education for clients at risk for cardiac disease, diagnose and recommend treatment, and provide heart healthy dietary and lifestyle education. I'd like to point out that our wait time is quite lengthy at this time. It's greater than 12 months at this point. So just be aware of that when you are referring your clients. Our team includes a cardiologist or a lipidemiologist, also registered nurse, pharmacist, and our allied health, social worker, dietitian, mental health if needed, as well as our unit clerk. Okay, so this looks busy. I'm not going to go through all of this, but I just wanted to point out that we have recently launched a new referral form. It is very detailed. So all of these boxes that you see here are all the reasons or the referral criteria. So please be very specific as to your the reason for the referral. And again, knowing that it's going to be, over a year wait. It is important to indicate the reason because we do not triage the referrals for the lipid clinic. So if you do not check an urgent box, we won't know that until a year later when we go to book the client in. So I'll talk a bit more about urgent referrals in a moment. But with the referral, please provide within the last 6 months a full lipid profile, including total cholesterol, LDL, HDL, triglycerides, total cholesterol HDL ratio. If able, a full medical history, medications, and any relevant consults or diagnostics is helpful. I'd like to mention that updated labs must be completed 4 to 6 weeks before their initial appointment. This is over and above those initial lipid profile that you sent in with the referral. Because it's such a long wait list, if the labs are not done, we will not be seeing the client. They will be canceled and rescheduled, which may postpone them being seen. We will provide a lab rec for that second set of lipids when we book the client for their first appointment. Okay, so just a little bit about urgent referrals. Again, you need to clearly indicate that it is an urgent referral. And reasons for urgent referral would include pregnant women with dyslipidemia, clients that have had a recent myocardial infarction with suboptimal lipid control and/or a need for our injectable medications, or clients that have triglycerides greater than 20. Again, please indicate what the reason is. That will alert at the initial receival of the referral that it is urgent, and we will we will do our best to get clients in within 1 to 2 months. Okay, so in terms of the referral process, same thing. We received the referrals via fax. They're pended into our system, and then they're put into a filing cabinet for a year. We do notify you at the time of the referral, faxing a letter to you to let you know that we've received the referral and the client has been added to the wait list. Then approximately 2 months in advance to their first appointment, the client is called, provided their appointment date and time, as well as the follow-up lab requisition, and all of that is mailed to the client. We will also send a second letter to the referring practitioner of the appointment date and time. Okay, and the lipid clinic is actually in the same area as the heart function clinic on the 3rd floor, level 3B. Just to mention that we are updating our fax number. The current referral form has a different fax number, but there will be, we will be receiving both until we were able to notify you of the new one. But please make note of this if you are referring to these slides at any point, that you can use this updated fax number. Our lipid clinic only runs approximately 2 days per week, and it's really just based on our physician schedules. And we are open from 8 till 4 as well. Okay, so now we'll move on to the cardiac rehabilitation and prevention clinic. We receive referrals for patients who have had a heart attack, have had heart surgery, either bypass or valve surgery, or an angioplasty. For clients that are high risk for developing heart disease, all patients will receive a cardiologist consult, an exercise stress test, and support from our registered nurse and exercise specialist. A majority, if not all of our referrals come from the hospital setting after a cardiac event. But if for some reason this had been missed, the family physician can send a referral form to initiate the program. So what is cardiac rehab? We help patients to enhance and maintain their cardiovascular health by helping them understand what happened, what brought on the cardiac event. We create individualized exercise programs for them. We help them in preventing disease progression and reoccurrence, helping them gain control over their health, and providing ongoing prevention strategies and reducing anxiety and stress. Some additional supports that we also provide along this anxiety and stress is we do have some stress management classes like deep breathing and relaxation. Those are offered as requested. It's not part, it's an additional part of the program. And that's once weekly for 4 weeks. And we also offer smoking cessation support through our respiratory therapist, and that's 12 sessions long. And our team is very similar: cardiologist, registered nurses, pharmacist, unit clerk, exercise specialist, physiotherapist, dietitian, occupational therapist, social work, mental health therapist, and volunteers. So for cardiac rehab, there's 2 parts to our program. One is education and the other is exercise. Did I lose the slide there, or you guys can still see that? We're good?
Good.
Okay. So I'll start with the education. So there is an introductory class. It is a mandatory class. If the client does not attend that class, they will not be enrolled in the program. So once we receive the referral, our unit clerk will call the client, ask if they're still interested in the program, and book them into the introductory Zoom class. And in that class, they'll learn information about the heart, procedures, risk factors, depression, anxiety, and goal setting. Again, they must attend this class to be enrolled, and we do run this class once weekly. Once they have completed the introductory class, they are called by our registered nurse, who will then enroll them into a consultation, as well as a stress test. And then they then can start the rest of the education portion, which is a 6-week cycle of classes with different topics. So we run on Mondays, we run a Punjabi education program, and on Wednesdays, we run an English education program. So topics include risk factors, heart test, nutrition, exercise and intimacy, medications, stress management, cardiac events, and the family. And clients can get right into this education portion immediately if they are interested. Okay, so once they are consulted by their cardiologist and have completed a stress test, they are then enrolled into our exercise classes. Classes are supervised by an exercise physiologist and registered nurse. There's a focus on cardiovascular training using cardio machines and calisthenics, followed by resistance training, balance, and flexibility training. We provide in-house monitoring such as telemetry to be able to monitor the heart rate while they're exercising, and ongoing support and advice by our specialty staff. There's 3 options for exercise. We have an in-person class. We run once a week for 12 full weeks, and we offer daytime, evening, and Saturday 75-minute long classes. We also have chair-based classes for clients with lower functional ability. And as mentioned, we can customize to the client's unique needs. Another option for exercise is virtual classes via Zoom. And currently we offer 2 English classes and 1 Punjabi class. And we have 2 classes that are on weekdays and 1 that is in the evening. Nothing on the weekend for the virtual, just the in-person is for the Saturday. And then we do have a subset called an independent exercise, and this is for clients that are quite high functioning independent, and they don't require that close medical monitoring. And so our exercise specialist will meet with them usually once, set them up with a good exercise program, which the client will independently do from either the gym or from home, and they'll just check with them every couple weeks to see how they're doing. And we also are currently working on bringing back our community rec center classes, hopefully by the fall. Okay, and so for the referral process, again, we receive the referrals via fax. As I said, majority of them are from the hospital. They are booked into that introductory class. Once they complete that class, they're then booked in with the doctor, the nurse, the exercise specialist, the stress test, and then they can start the education and the exercise component. I just want to mention that we do not notify the family practitioners that the client is enrolled in our program. You likely will anticipate that they are because they've just had a cardiac event. You will, however, receive a copy of the cardiologist consult and note indicating recommendations for exercise, the results of the exercise stress test, and risk stratification. Once the client has completed the exercise program, a discharge letter will also be sent to family practitioners and the cardiologist. Again, Jim Pattison, the cardiac rehab program is located on the first floor at 1C. phone number, fax number. Monday to Thursday, we're open from 8 till 8 o'clock at night. Fridays, we are open from 8 till 6 o'clock in the evening, and Saturdays from 8 till 4. Thank you.
Thank you so much, you guys. I'm not sure, Mariah, did you have anything else that you were adding on to the end of this, or did you want me to do you guys have time for a couple Q&As?
Yep, we have time for questions if there's any.
Yep, there's a few here. And just quickly before I get into the questions, for anybody who has to leave quite quickly, I've posted the evaluation link into the chat. So just quickly, there's only a couple questions there if you want to fill that out. So the first question is related to the exercise classes that you were just chatting about. Is there a fee for those exercise classes?
No, there's no fee.
And then there was a question about the lipid clinic. Do you send the lab rec directly to the patient, or do we have to do it?
So as I mentioned, with the referral, you will send the initial lipid profile, but the follow-up one that gets done prior to their appointment, we do mail that to them. They will get a hard copy, and they will go and get the labs done independently.
Awesome. And then there's a few questions here that were related to the beginning. We were talking about the heart function clinic. Do patients need annual follow-up appointments?
For the heart function, no. So once they're discharged from our program, if there's some concern that their condition is worsening or more frequent hospitalizations, and you feel that a re-referral is necessary, we will do that. But otherwise, no. Once they're discharged, we're done with their care. Again, certainly can re-refer if needed.
Another question from Glenda. What if the test sorry, let me try that again. What if the test is still pending? Does the patient or will the patient be called for their appointment?
What test? I'm not sure what that means.
I presume this is probably one of the tests that they need as part of their referral package.
Well, I wonder if it's referring to the lipid clinic. So we do give clients upwards of 8 weeks to complete their labs. And so that's more than enough time. And so if they have not completed them within 2 weeks, we will cancel. We can't assess and treat if we don't have the most recent lipid profile. In terms of the heart function clinic, most of the information that we need is actually from the hospital. We can get the most recent echocardiogram, the most recent labs. It's a nice to have if you do have it, but for the most part, we can access relevant diagnostics.
There's another question here related to the heart function clinic. Should all patients with CHF be referred to the clinic?
No, not at all. Only we do try and focus on new diagnosis if we can, because we do know that the quicker we can get them on the guided medications, the better that they will do sort of long term. So as I mentioned, so just a diagnosis of heart failure without any symptoms, no. If they're having worsening symptoms, yes. If you're having trouble managing their symptoms, absolutely. Or you'd like some specialty information on, what medications would be more appropriate for them. As I said, we do follow them quite closely. So, every couple of weeks we can up titrate those medications. So it's a good place for that initial medicated therapy. Yeah.
And last question, will there be other languages offered in the future?
Very good question. We do, it's really kind of just based on our staff, to be honest with you. And we do have some interest for Cantonese down on our cardiac rehab program. So that's something we've talked about. But I can tell you that in terms of resources, on the Fraser Health intranet, under patient education, any of the, whether it be cardiac rehab, heart function, you can choose the language. So we can give hard copies in any language is available. Most any, I should say. But
Thank you. That was all the questions that were in the chat. For those of you who are still online, just want to let you know that we will be sending out the slides, and we'll compile the Q&A that was there today and send it out to you within the next week or so. The evaluation link has been posted in the chat, and I just want to very quickly once again give a big thank you and round of virtual applause to Mariah and Jerry for coming out and sharing some time and some really great information with us today. So thank you very much.
Thanks for having us.
thanks for having us. Yeah.
Bye for now, everyone. Enjoy the rest
Bye.
of your day.